Hi everyone, my name is Patrick and I'm working as a global product manager for the Medi-Globe group in the fields of urology, and today I welcome you for our basic training for our product group Urinary Diversion. After this short introduction, we will start first with our solutions for the so-called urinary renal diversion. And the second part will be about to talk about our products for the so-called urinary vesical diversion. Let's hop straight into the urinary renal diversion. Here, what is it? It is about the need to drain urine straight from the kidney due to a so-called urinary retention. What is a urinary retention? It is a blockage for the flow of urine due to several possible root causes, which can be, on the one hand side, the so-called acute obstructions, maybe due to stones or similar. Then there is a possibility for chronic obstructions due to strictures or the growth of tumor tissue. And on the other hand side, we have the other applications like the prophylactic one, that after a stone management procedure, for example, we want to make sure that there will no swelling of the ureters, for example, which will cause a blockage and problems on the other hand side. Let's talk about our solutions for the discussed field of the urinary renal diversion, which is on the one hand side our ureteral stents, which you can see on the left hand side, and on the other hand side we have the so-called nephrostomy catheters, which are displayed on the right hand side picture. When is what used? At the end of the day, it's both used or needed to help with the urinary retention in the kidney, but at the end of the day, it's mostly dependent on the defined procedures inside of the hospital and also the preferred procedures by the doctor. But in general, you can say that the hospitals first will always try to get in a ureteral stent. If that is not possible for some circumstances, if the blockage, for example, of a ureter is so strongly that you cannot insert a so-called ureteral stent, then the nephrostomy catheters will be used as some sort of an emergency procedure. Let's now discuss what a so-called ureteral stent is. A ureteral stent is a hollow tube which is fully or partially implanted inside of the urinary tract between the kidney and the bladder, and those stents are used to drain the urine straight from the kidney to the bladder when there is a blockage for the urine flow. The most common products used for the product group ureteral stents are the so-called double J stents. Those have two kringles, one kringle for the fixation inside of the kidney, one kringle for the fixation inside of the bladder. And the other most common products used is the so-called mono J. Here, as the name says, you only have one kringle for the fixation inside of the kidney, because the tubing will leave the body either percutaneously, that means through the skin, or through the urethra. Very common terminology here are the so-called double J stents, DJ, the mono J stents, MJ, or ureteral splints, or the pigtail stents. How do we insert those products when we have a urinary retention, for example, due to a stone inside of the ureter? On the one hand side, we will start with the insertion of a cystoscope inside of the bladder. With the help of the cystoscope, we are able to insert a guide wire all the way up to the kidney, which can be used afterwards as some sort of a motorway to get the stent inside, along the guide wire, inside of the kidney, the ureter, and the bladder. When I'm at the right location, that means the kidney pigtail is inside the kidney, I can slowly remove the guide wire, and due to that, the pigtail will start to form again on the one hand side inside of the kidney and afterwards inside of the bladder, ensuring a safe fixation of the urethral stent inside of the urinary tract. Now the stent is inside of the body. Now we're talking about the so-called indwelling time. That means now the stent fulfills its full function. That means ensures the drainage of the urine that was blocked before. And normally we're talking here about the indwelling time of roughly some days or some weeks, because we need the stent for the acute solution of the blockage. But in some cases, for example, for patients with heavy tumor growth or strictures or deformation of the urinary tract, we're talking here about the so-called long-term solutions, which will be about several months or years. Now we're done with the procedure. We helped with the urinary retention. We removed, now we want to remove the urethral stent. And what we're doing here normally is again to insert a cystoscope inside of the bladder. We're using some sort of a grasping forceps to grab the vesical pigtail of the stent and then remove it out of the body. Now let's talk about our product portfolio for the urethral stents. Our two standard products we're having are the so-called White Star, you can see it with the color, and the so-called Green Star. And both stents have a very, very wide range, a very big portfolio, have a very good price, are very cost efficient. The difference between both of them is that the Green Star stent is manufactured with a little bit softer raw material, ensuring a little bit more patient comfort for very sensitive patients. Now we're coming to the more specific stents. On the one hand side, we have our both Yellow Star stents. You can also again see it due to the yellow colorization. Both Yellow Star stents are treated with so-called phosphorylcholine, PC abbreviation. And this coating ensures or enables a long-term application for, as I said, patients with strictures, deformations of the ureters, and so on. And especially for patients that have to deal with tumor growth inside of the urinary tract, there's the so-called Yellow Star tumor stent configuration, which is manufactured with a very, very stable material for the shaft. So there is no compression from the outside due to the tumor growth, and also has a very soft Green Star material for the pigtails for a higher patient comfort. Last but not least, we're talking here about our so-called magnetic Black Star, the black one. This is a very, very unique solution, the only solution that enables the withdrawal of the stent with a magnet. That means here there's no cystoscope needed for the insertion and the removal of the stent. And this ensures a better cost-efficient procedure because there's no cystoscope needed. And on the other hand side, it's more convenient and less painful for the patient to remove the stent. Now coming to our product portfolio as a whole, you can imagine there are different kinds of stents available. Some criteria are the following. You can differentiate between the stent diameters. We have more than 10 different stent diameters, also stents with stage diameters, very special configurations, and also we have stents with various lengths. So we're talking about a total variation of 20 lengths and upwards for our stent portfolio. Other differences in our products could be the special stent properties. That means variation in terms of pigtail forming, markings, hole configurations, and so on. Also, as you already heard, the stents are manufactured with different materials to enable different kinds of applications or fulfill different needs. Also, for example, the PC coating for the yellow star stent enable also better or other gliding properties for the insertion and removal of the stent. Last but not least, the stents do not come completely alone. They're packed in different set configuration. That means you can purchase a stent alone, but they can also be offered with guide wires and so-called pusher devices. So that means here we also have some sort of a variation in the portfolio. Now we're coming to our second solution for the urinary renal diversion, which is the nephrostomy or the nephrostomy catheters. What is it? A nephrostomy catheter, again, is a hollow tube, but this time the hollow tube is inserted directly to the kidney through the skin. So the urine now is drained not inside of the bladder, it's drained to the outside of the human body, to the atmosphere. The most common applications or products used for this are the so-called pigtail catheters or the so-called balloon catheters. Let's talk about firstly how I introduce or how I insert those kinds of products. As I said, first we need to puncture the skin and also the kidney to have an access to the organ. So puncturing the kidney under ultrasound guidance. Now I can use the hollow inside tubing of the puncture cannula to insert a guide wire, again as some sort of a motorway, to be able to dilate, that means widen the access step by step to make it bigger and bigger, to be able to insert a catheter for the drainage at the end of the day. Now we have the catheter in place. Again, the catheter is now able to drain the urine after the urinary retention. The normal indwelling time for such a catheter is rather short term because, as I said at the beginning, it's needed or used most of the time for emergency procedures when there's a very heavy blockage of the urinary tract. The long-term nephrostomy is rather used for the palliative care. The removal of the stent is quite easy. You can gently pull on the outside or the part which is hanging outside of the human body, pull on it, and then you can get a normal dressing on it, and the removal is done for this kind of product. Now coming to our product portfolio, on the one hand side, as I said, we're talking about the so-called balloon catheters. The balloon catheters are or can be used for all kinds of indwelling times. That means it can be used for short-term application, but also for the palliative care for rather long-term applications. What is important here to understand is that for the balloon catheters, a so-called balloon, inflatable balloon from the outside is used to make sure that the catheter stays in place during the complete application time. Advantages for this kind of product is that silicone is a very high quality material. It's very good tolerated for the patient, and also the balloon is a very secure method to have the product in place during the indwelling time. On the other hand side, the disadvantage of balloon catheters is that they're quite costly in comparison to the pigtail catheters. The pigtail catheters you can also see on the right hand side of the slide, bottom right. Rather short-term application time, and for this not a balloon is used for the fixation. Here we are using a pigtail again, and the pigtail retention force ensures that the product stays in place during the indwelling time. Here the advantage is it's very simple. It's a very simple product. it's very cost efficient, but since the pigtail is not as strong as the balloon, the users have the tendency to suture also the catheter to the skin to be 100% sure that the catheter stays in place during the application time. Again, let's talk about the variations. As you can imagine, here again, different catheter diameters up to 6 different sizes. Also, normally there is one standard length for all nephrostomy applications, but here also we offer 2 different kinds, one very short and one very long catheter configurations. For the special properties of the catheters, we're talking here about differences of pigtail locking mechanisms, for example, or different markings, connectors, all different kinds of different technical properties of the catheters. On the other hand side, again, we're talking here about different catheter materials and coatings, but also at the end of the day, as for the urethra stent, different kinds of set configurations, including guide wires and needles for the puncture sets, but also dilators and other kinds of adapters. Now we're done with the very first part, which was the drainage from the kidney directly. Now we're talking about our range for the so-called urinary vesical diversion. That means the drainage directly from the bladder of the human body. And again, why do we need solutions for the so-called vesical diversion? Again, when we have the need to drain the urine due to a urinary retention. And the urinary retention here for the bladder could be, again, acute obstructions, for example, for male patients, that's the most common, a swollen prostate that will block the passage from the bladder to the outside. On the other hand side, we're talking about potential chronic obstructions, strictures, tumors, and so on. And last but not least, we're talking about all of the other applications, like when we have the need for a drainage or irrigation of the bladder after a resection of a prostate or bladder tumors. Now we can have a look at our different solutions we have in our portfolio. You can see them also on the right-hand side. On the one-hand side, we're talking about our transurethral catheters. Those are the catheters that are inserted through the urethra of the patient inside of the bladder. Here we have the normal transurethral catheters, but also the so-called transurethral irrigation catheters. What this is all about, we will talk in some minutes. But we also have the so-called suprapubic catheters, and those are the alternative to the classic transurethral catheters, which are, or the suprapubic catheters are inserted through the belly inside the human body and the bladder directly. When to use what? Normally, when there is a retention, a blockage of the urine flow causing some problems, the doctors will have the tendency to try the normal transurethral catheter first because it's very less invasive, or basically no invasive. You use the normal way from the outside to the inside of the bladder. But sometimes the blockage, for example, due to a very heavy swollen prostate, it's not possible to get in a transurethral catheter. So what you have to do now is to puncture the skin to get a catheter inside of the bladder from the outside, which are then the so-called suprapubic catheters. Last but not least, the irrigation catheters, also transurethral, are normally not used when there is a blockage, but it is used to prevent a blockage after a procedure, for example, the resection of a prostate, as I said, or the resection of bladder tumors, where there will be bleeding after the procedure. and now you want to insert an irrigation catheter to be able to flush and drain the bladder continuously over a period of time, making sure there won't be a blockage in the future. Let's talk about our range. Firstly, let's talk about our transurethral catheters. You can see them on the top right. We're talking here about hollow silicone tubes. Two-way catheter, they are also called two-way because one way is used for the drainage of the urine and the other flow channel is needed to block the balloon, as you know it already from the nephrostomy catheters, from the outside, to have an inflated balloon inside of the bladder to be sure that the catheter is not migrating. Now we're talking about our so-called suprapubic catheters. Also here we are talking about two-way hollow silicone tubes. Again, one channel is needed for the drainage, the other channel is needed for the blocking of the balloon. The big difference here is that for the suprapubic catheters, the tip is open, that means a central hole is here to be able to insert the catheter with the help of a guide wire when we're going for the puncture of the skin. Last but not least, we're talking about our so-called irrigation catheters. Again, hollow silicone tubes, one channel for the drainage, one channel for the fixation by inflating of the balloon. And here the big difference is that the irrigation catheters always have an extra third channel which is used for the irrigation. That means here you can connect a sterile saline bag to have an inflow inside of the human body to ensuring that blood residuals or bleeding after a resection is cleared and there won't be a blockage afterwards. Again, let's talk about our different configurations. We have a very big portfolio here, different catheter diameters. The most common one for the normal transurethral catheters are 14 French, for the irrigation catheters 18 to 20 French, and also normally we have a very standard size of 40 centimeters, but also offer shorter ones. Special catheter properties. Here it's important to offer different variations of balloon volumes. Also the markings are important, for example for the suprapubic catheter, to have a success control if the catheter is already inside of the bladder as some sort of a success control. Also for the suprapubic catheters we have a wide range of set configurations. As you can imagine, set configurations with guide wires and so-called split needles and dilators to be able to insert the suprapubic catheter through the skin inside of the bladder. Now we're done with the basic training for our range for the urinary diversion. Hopefully you liked it. I enjoyed it a lot. Thank you so much for being here. And I hope that we will see us soon in our advanced training for our range. Thank you so much.